First, I want to thank our sponsor, Dew Consulting, and I'll introduce Peter Dew in just a moment. But I just wanted to also let you know that the funds that are going to be collected from this evening's program will be shared with the panelists organization as a donation from AIA Baltimore. So I am Zolna Russell. I am the co-chair of the AIA Code Committee along with Ben Rausch, and we are shepherding a group of like-minded people who care about sustainability to advance the conversation in Baltimore and in Maryland. So we very much would love to have you join us. And if you're interested in that, my contact information and Ben's contact information can be found on the AIA Maryland website. So it's now my great honor to introduce Peter Dew. Peter and I have known each other and worked together for many years. And he is really one of the people in Maryland and in the nation with the most street cred in the sustainability front. He is the founder of Dew Consulting, which is a sustainability consulting company. He's been recognized nationally and locally as a fellow of the AIA, a lead fellow, and a Living Building Challenge hero. He's been instrumental in crafting and advancing the Baltimore City Green Building Law and has served on the Sustainability Commission. So without any further ado, I'd like to introduce Peter Dew. So thank you, Peter.
Thank you, Zolna. Thanks for the introduction, and thanks to everybody who's joining. I'm going to just take a quick minute to say a little bit about how this program came to be, and then introduce the panelists, and we'll just get right into it. So this program is the result of the AIA Code Committee's desire to create a series of programs this year that focused on the impact of planning and planning policy on environmental and social equity issues. Then as we started to create these programs, I think we realized that these issues straddle so many areas of expertise, of interest, and significant issues for the city. And so we decided to open the program up more broadly to a broader community. And so we're really glad that you're here. But we do try and have these focus on sort of, as this Committee on the Environment from the AIA, sort of opportunities for architects, planners, and people of that ilk to sort of see, what we can do or what we can learn to do a better job in promoting a more equitable city and more equitable designs. So this program is on food insecurity, and we have three panelists. I'll introduce them in the order in which they'll speak, and the first one will be Holly Freishtat. Holly is Baltimore City's first food policy director, and began her work in the city in 2010. She created the Baltimore Food Policy Initiative, an intergovernmental collaboration that aims to address food system policy in the city. She was honored in 2016 as one of Maryland Daily Record's top 100 women in Maryland. And the food policy initiative that she created has been recognized internationally with the highest award for their implementation of the Milan Urban Food Policy Pact in 2016. Holly will tell you more about her background and what she's doing, and the second panelist will be Sha'Von Terrell. Sha'Von is a voice in the Black food and land sovereignty community and a strategic food systems planner specializing in food and land sovereignty. Sha'Von's passion is rooted in Black self-determination, collective organizing, and reclaiming their right to agriculture. As the deputy director with the Black Church Food Security Network, Sha'Von manages a local food market that steers thousands of dollars in support towards Black farmers and small business owners. Additionally, she travels the country organizing and consulting with major institutions such as colleges, universities, churches, and other organizations. And through this work, she advances local self-reliance in food systems. She holds a master's degree in City and Regional Planning from Morgan State University, locally, and a Bachelor of Science in Political Science from Tuskegee University. And our third panelist is Monica Guerrero Vazquez. Monica is a public health professional and a strong advocate for health equity and social justice, and passionate to improve the quality of life for immigrant origin communities. Monica has worked with the Center for Health and Opportunity for Latinos since 2014, and currently leads the center as the executive director, where she oversees programming and research addressing issues affecting social determinants of health of immigrant communities. And with that, I'm going to let Holly introduce the topic.
Great. Good evening, everyone. Thank you, Peter. So once again, I'm Holly Freishtat, Food Policy Director for the City of Baltimore and the Chief of the Food Policy and Planning Division. Next slide, please. And so the Food Policy and Planning Division, we oversee the Baltimore Food Policy Initiative, and it has 3 pillars. Our interagency collaboration, over 19 agencies, our Food Policy Action Coalition, over 60 members, and our resident equity advisors, which ranges each year around 15 residents. We compensate them for their time and their experience in guiding us in our strategies. Next slide, please. So together, we are building an equitable and resilient urban food system. Next slide. And we use food as a catalyst to address health, economic, and environmental disparities in areas of high food insecurity. So on the next slide, I want to talk a little bit about how the food environment mapping drives strategies and policies. So next slide, please. So from 2012 until 2018, we were food environment mapping using the layer of healthy food priority areas, formerly known as food deserts. And that was really to acknowledge and note that the built food environment impacts food insecurity. So this layer is really determined by the food environment, meaning that every food retail establishment had a healthy food availability score. And so the red areas are areas where there's unhealthier food sources, and also low income and low vehicle availability, and supermarkets are not easy to get to in over a quarter mile. In this map, 146,000 people are in healthy food priority areas. That led to a healthy food environment strategy and a briefs I'll discuss shortly. And that was what we were doing until COVID hit. Then you look at the map next to you, 2020, all that data was irrelevant. Overnight, we saw escalating food insecurity. And so we started to collect data on a monthly basis from the state using SNAP data, where now 1 in 3 residents are on SNAP, which means that SNAP will actually reduce food insecurity, but it's an indicator of high need and high food insecurity. And this has led into our COVID response and briefs I'll discuss next. Slide, please. So these are our food environment briefs from 2018. These briefs from city to council, each of the council districts to legislative, are instrumental in briefing every council member, the Maryland legislature, so that policies can be informed by data and that policies can change. Next slide, please. Then more recently in 2020, we have developed out our COVID-19 food environment briefs. We have a city brief and then 14 council district briefs. And when you go into the council district briefs, you can really see more of the nuance of what the retail environment or the food assistance environment looks like. Next slide, please. So now I'm gonna give you a quick overview of how we're integrating food into plans and policies. So one significant change was in 2019 with the sustainability plan. We had 2 new sections in that plan. One was on specifically food systems, acknowledging the importance and need to use policy to create an equitable food system, the importance of resilience from not only food system level, but community and household. And then the third part is really looking at wealth building. How do you strengthen and amplify the local food economy? And in order to do that, there is no magic bullet. It has to be really an 8-point plan. Our healthy food environment strategy acknowledges that residents need to be centered in the process first and foremost, and that we need to address simultaneously the retail environment from corner stores to supermarkets to public markets to supply chain, to federal nutrition assistance, urban ag, and transportation assets and gaps. Next slide, please. The other part of the sustainability plan that was new was on urban agriculture. And I want to take a moment and read the main goal of this chapter. This plan and this chapter is committed to a city committed to where communities that have been historically excluded from access to land and to fresh, healthy, culturally appropriate foods are those that benefit most from urban agriculture activities. So this is really centering the efforts on the BIPOC communities in Baltimore and making sure that they have access to land use policies and land and pathways to land tenure, to promoting safe and sustainable production, and also looking at support so they can be financially viable in urban ag. Next slide, please. So some of the key things is we had to change the zoning code so that urban agriculture could be sold, at farm stands. We had our first urban ag plan adopted in 2013, a lot of work around farmers markets, CSAs, urban ag tax credit, land leasing, and regs. Next slide, please. So I'm going to now segue into what happened when COVID hit. Next slide. All the disparity and all the inequities that were already in our food environment was escalated. We were in 1 in 4 residents were on SNAP prior to COVID, and then during COVID, 1 in 3. And we have a 4-point plan really looking at making sure people could stay home and have enough food to stay home at our food box distribution. So this is really looking at understanding the food environment and understanding that there's a lot of unhealthy food retail in these communities and making sure that we center around perishable product. So focus was on produce boxes, mixed food boxes, and also home delivered grocery boxes to those who are homebound. To date, probably over 12 million pounds of food, over probably close to 500,000 food boxes at 100 community sites. Our focus was decentralizing small sites throughout the entire city, so no one needed to go far. We do not want any congregation of people. The second part is really, there's already a lot of meals going through the system, through schools and through older adults, but to really maximize those numbers, but understanding that people need to stay home. And that's why we had so much emphasis on food distribution. Next slide, please. In addition to that, and one thing to note on the mapping is that we were mapping SNAP and need the whole process. And we were also understanding and acknowledging that SNAP is not representative to the community at large, and the Latinx community may not be represented in SNAP due to many policies. So therefore, we're looking at other data layers on which I know Monica will be discussing. And so in our mapping, we took the Latinx community into account. And as we started to see increased COVID cases in the Latinx communities, we increased the number of food boxes in those communities. And then in this slide, urban agriculture, I would say that this is probably one of the best parts, and maybe Sha'Von, you can speak to this or not, of COVID-19 was the funding community really stepping in and acknowledging the role of urban farms and food resiliency, and the fact that this could have a long-lasting impact on our city, and it's not just short-term anti-hunger feeding. And also understanding that they are essential as far as part of our food source, and also being really respected and hopefully have access to the vaccine soon enough. We've let all our partners who are essential employees know the process to be able to go through the vaccination process. We've also have really tried to leverage as much funding as possible to support urban ag and food resiliency, especially during COVID. Next slide. So to conclude, just go to the last slide real quickly. Where are we going now in light of COVID-19? So just to put it into perspective, our team prior to COVID-19 was doing food policy, planning, community engagement. The minute the schools closed, our team, which is 4 of us, just to be clear, went 100% on COVID-19 emergency food response, and we still are 100% of our time, close to 6 to 7 days a week on the response right now. So what we're hoping to do is, now that our SNAP numbers are going up, which is something we needed to see, and that there's more resources, we're looking at how do we continue to address the high need of food insecurity right now, hoping to look into the future of the innovations of the ride share, which we piloted with Lyft, nutrition incentives, and then really acknowledging that food is medicine, and how does that get built into the insurance system. And then also, of course, our continuation of our work to really make sure our policies and plans support urban agriculture and that we meet the needs that are asked of us as it relates to sustaining urban ag in the city. And then also really looking at how do we create a food retail environment that is not dependent on one food source. So for so long, it has been whether there's a supermarket or not a supermarket in a neighborhood, but a resilient neighborhood is one that has many prongs to it, whether it's a small footprint store, a supermarket nearby, urban farms, community gardens, farmers markets, corner stores that have healthy food, but really looking at a resilient, healthy food environment. With that, I would like to turn it over to Peter, and then Sha'Von will be speaking next. Thank you very much.
Okay, I'm just going to introduce Sha'Von. So Sha'Von, go ahead and take it away.
Good afternoon, everyone. I am Sha'Von Terrell. I currently serve as the Deputy Director with the Black Church Food Security Network. And I'm also a professor at Towson University, and I see that some of my students tuned in. So I'm excited to be here with you all today. I'm speaking on the topic of building a community-controlled food system. And the case study is the Black Church Food Security Network. You can transition. So the mission of the Black Church Food Security Network is to co-create community-owned alternative food systems that are anchored by the resources that's found in the Black community, such as the Black Church, and in partnership with Black farmers. We were founded in 2015 in the midst of the Baltimore uprising. In the midst of the uprising, oh, you can go back to the first slide. A lot of the bus transportation lines in Baltimore City, especially in Black communities, were shut down. And a lot of Black communities are considered healthy food priority areas, specifically in East and West Baltimore. So during that time, many communities were without access to food during that time. Access means having the opportunity to source food and being in close proximity to healthy food without that time. So the founding director of the Black Church Food Security Network, Dr. Brown, manages a community garden at his church where he pastors, Pleasant Hope Baptist Church. And many of the community leaders reached out to Pleasant Hope Baptist Church for them to donate some of their produce that they'd been growing in their community garden to the communities that were without food during the uprising. The garden is only 1,200 square feet, so it grows 1,100 pounds of produce on a yearly basis. And that is nowhere near being enough to feed an entire community. When you think about the statistics of food insecurity in Baltimore, it's 1 out of every 4 people. And that looks like 2 Meek Youth stadiums with a Ravens play filled up. So 1,100 pounds is nowhere near enough to feed a community. So he partnered with farmers on the eastern shore of Maryland who have been growing food but don't necessarily have market access to sell their food. So that experience created a niche market for Black farmers to sell their produce directly to the community through the interface of the church. So the church during the uprising turned into a food hub and a food distribution center that distributed food to those communities that were without. You can transition to the next slide. So why the Black church? The Black church has formalized the tradition of mutual aid and self-reliance. We can see it through the founding of historically Black colleges and universities. I am a graduate of 2 HBCUs who have roots from the Black church. Morgan State University was actually founded by pastors coming together in Baltimore to say we need a school for our community. And Tuskegee University was actually where Booker T. Washington held his first classes when the students was actually building the bricks to build the buildings on campus. So we are nestled in that long tradition of mutual aid within the community. So during this time, we are empowering churches to reimagine their assets now for community food security. And here are some pictures on this slide of elders and ancestors whose shoulders that we stand on. Like I mentioned before, this is nothing new to the Black church community. The picture that's directly in the middle with the man standing up is Father and Mother Divine. In the midst of the Great Depression in New York City, they bought land, they pulled all of their financial resources together as a church community, and they bought land in upstate New York, and they used that land to grow produce, to have cattle and different meat, and they transported that produce and those items to their grocery stores. You see a picture of their grocery store, you see a picture of their cows, and they transported it to inner city New York where their church is located. And they had these big grand feasts in the midst of a whole depression. They was doing phenomenal work. So we are rooted in that experience and remembering that our community have assets that could be leveraged and that can be reimagined for community sustainability and empowerment. You can transition to the next slide. So we do this through our 3 major programs. Operation Higher Ground, that's when we transform open spaces, underutilized parcels of land into community gardens. So we help churches get their gardens started. We offer seed funding, $500 to them to buy the soil, to build a raised bed. And we also support our churches by hosting quarterly and monthly trainings for them to learn about garden management. The next slide. We also transform multi-purpose rooms, dining halls, any open spaces that churches may have, such as parking lots, into mini farmers markets. So we bring in Black farmers, and so they can come in and sell their produce directly to the community. And the next slide. And the Black Church Supported Agricultural Program. So this is actually our newest program that was founded in September of last year in the middle of this pandemic. We realized that a lot of churches are establishing food pantries and food banks and different food distribution programs for their community. And we, on the other hand, we also acknowledged and saw the fact that Black farmers weren't receiving the contracts from the USDA for those food box programs. So we saw an opportunity to connect our farmers to this niche market that was created as a result of this pandemic. So we buy bulk items from Black farmers, such as greens, sweet potatoes, produce. We also have the meats for the people who love bacon and pork products. And we buy that from Black farmers in Virginia and North Carolina and in Maryland. And we transport that using the church van at times to churches who have distribution programs. Now in the next slide. So like I mentioned before, the ultimate goal is to build community-based and community-controlled food systems by utilizing the assets that's found in our community, and specifically the assets that's found within the Black church community. So we are engaging churches to engage and participate in the various parts of the food system. We understand that churches may not necessarily have access to arable land where they can grow produce on, but we also acknowledge the fact that churches may have commercial kitchens, and those commercial kitchens could easily be used as centers of food processing and turning strawberries into strawberry jam, turning tomatoes into tomato sauce, and also as a space of learning to teach people about food nutrition and how to prepare their foods in healthy ways. And the next slide. So this is our food system. It's growing. So the Black dots on the map are where we are partnering with Black farmers, and the orange pins is where we have churches that we are in partnership with. So we are growing out west. We have a church in Omaha, Nebraska. We have a budding cluster in the Georgia area, Atlanta, and in South Georgia. On the next slide. So our guiding principle to this work is collective agency and community resilience. And this is a term that was coined by Dr. Monica White of Freedom Farmers. So if you're an avid reader, I would strongly encourage you to read this book. So basically, we are rooted in pulling our collective resources together to create alternative solutions that's supported and anchored by and led by the community. And I think that might be it. And here are ways to stay connected. Thank you, everyone.
So Sha'Von, maybe you can take some of those contacts and post them in the chat so people can see. I think at the end, Nathan, you'll share the chat publicly. I don't know if that's being done now or not, but
Yes.
okay. And so I'll just say, you know, if you have questions, please put them in the chat. We'll have a discussion after Monica speaks. And Monica's going to talk about the Latinx experience. I think both pre and during. We haven't gotten to post-COVID yet. So
I wish.
yeah, we wish. But so go ahead, Monica, and yeah.
Thank you. Thank you very much. It's really an honor for me to follow Holly and Sha'Von. Amazing and inspiring work. I'm just a student. I feel like a student learning from them here. I'm happy to be here and share some of the work that we have done at Central Soul, particularly addressing food insecurity. Next slide. I would like to give a little bit of background on who are Latinos in Maryland. Probably this is something that you already know. So just to remind to those who already know this and to those who haven't seen this before, this is new information. The Latino population in the U.S. is about 1 in 4 people in the U.S. are young people in the U.S. are Latinos. In Maryland, the population has increased to reach about 9% of the overall population in the state. And in the image on the right, you can see who are, or what's the age ranges. So far that we have on record is the 18 to 44. So they are very young compared to the general population in the state. In Baltimore City, Latinos represent about 8% of the entire population, and the city has 5 non-English languages, including Spanish as the largest, but there's also Chinese, French, Korean, and Arabic. So you can think the challenges that pose in terms of how we are going to reach out to these communities, how we're going to communicate and provide information, and the issue that we experienced during the pandemic that I'll develop a little bit more about how we provide communication and information to the community. Next slide. This is how the Latino population in the city look like right now. I'm really eager to see the data from the census from 2020, but the maps are very clear. The darker or the more reddish the area, the more population, the higher the rate. So in 2018, we can see how the Latino population has increased and expanded from southeast to the entire city. We have seen the increase of Latinos going to the county border areas of Baltimore City. There are many disconnections. People are coming to this neighborhood. There are more people, but there are less resources. So before the pandemic, communities in South Baltimore and West Baltimore were underserved, and during the pandemic, the disparity was exacerbated. Next slide. The overall increase of the Latino population in the city has been over 134% in between the maps that I showed before. So with that in mind, Central Soul was funded in 2013 by a group of physicians that work at Hopkins who were seeing the increase of Latinos at the practice, but really there were not enough resources to provide language services for this community. Many of them speaking Spanish as a second language already, and literacy is usually very low. In general, it's like 6th grade or less. The mission of the center is to promote equity in health and opportunities for Latinos, and we work in different areas. Our center is not a place, even though that's my wish to have a place where we can run programs. Our center works in collaborations with multiple organizations, including Holly's office, for example, and we have different core areas that I'm going to develop in the next slide, but basically, the collaboration has been very helpful for us to build capacity and start building this safety net to provide support to the immigrant communities that are facing inequalities, inequities, and disparities overall across the lifespan for them. Central Soul hosts more than 60 events per year. Those events became virtual, so we were able to host a lot of events during the pandemic too, informational events, trying to promote resources about how to prevent the spread of COVID-19. Right now, we're working a lot on providing information about where and how people can get the vaccine. And especially there is a lot of fear about the public charge and how that may impact how they access to the vaccine. And we have been in existence since 2013, and we work closely with the Johns Hopkins Hospital and the pediatric clinic at Bayview, where we see about 12,000 encounters with Latino patients. Next slide. As I mentioned before, Central Soul sits at the crossroads of community, academia, and research. We work with different groups and projects promoting health equity, for which we observe the quality of the policies implementations and try to advocate for access to a SNAP or to Medicaid to ensure that US-born children have access to the resources that they need. We have to remember frequently that the immigrant community in Baltimore is fairly new. So that means that there aren't a lot of generations here. We're just seeing the second generation starting, but most of the families that we serve are first generation immigrants, and we have a lot of parents who are undocumented and children who are US born, and that impacts how the resources are being distributed. To address that now and thinking of how to diversify the workforce, we run a youth pipeline program, and we work with bilingual and Latino youth. Many of them are immigrants. Some of them are US born, first generation, planning to go to college. And we're trying to expose them to careers in healthcare and medicine and also public health. We don't have a clinic, but our co-director is the medical director of the Access Partnership Program at Johns Hopkins that provides specialty care for individuals who don't have insurance. And 90% of those individuals were African American before the Affordable Care Act in 2010, and after that, there was a shift, and 90% of the patients that receive this benefit or this charity care are Latinos. We also work a lot on research. We want to inform our programs and also capture data and try to understand what the needs of the communities are and how our programs are culturally appropriate or not, and understand overall the health outcomes of this community. And finally, the community engagement is across all of our projects and components, and it's super important for us. We have advisory boards for our programming, our research, and our clinical practice. Next slide. Click next. This is not new. We have seen this frequently in the news in the past year. We have witnessed that the COVID-19 disproportionately impacted Latinos. We have seen 42% of cases positivity rate. That's very high compared to like 30, 10, 15% of non-Hispanics and non-Hispanics white in Baltimore City. Also, the families that came to get screened sometimes came very sick because they were still working. They were not following guidelines because they didn't know how to do or how to prevent the spread of COVID-19 or how to get infected, but also they couldn't stay home. And that's kind of the motivation that started us in the food insecurity and to address food access, is because they couldn't stay home. They had to leave the home and go to work. And people were very scared about how the being screened or being tested was going to affect and if the public charge was going to affect them and their ability to get a green card or immigration status. Next slide. Next slide. So these are some of the areas that Central Soul has been working as in the COVID-19 response. I'm going to list them, and I'm going to focus on the food insecurity. But we have been collaborating with the Mayor's Office of Immigrant and Multicultural Affairs and community organizations and Johns Hopkins to address housing and economic hardship. We have been leading some of the initiatives for community testing and working with inpatient units once the patient is in the hospital. Our medical directors have been working with the care team to ensure that the patients do have language services, that they do know where to go, that they do use services that are accessible to them, like food, cash assistance, or a place where they can stay to quarantine because they live in a multi-family unit. We have been running education town halls and forums in Spanish with different groups to make sure that we give information and demystify some of the concerns that people had around COVID. And currently, as I mentioned before, we are working to advocate for equity in the COVID-19 vaccine rollout. We're collaborating with some groups in the community, the health department, and a coalition that is working with organizations across the country to understand what are the needs and barriers and what we can do to ensure accessibility of the vaccine. Next slide. So in 2020, as you could see in the previous slides, we don't focus on food access necessarily. We do all kinds of work. We work on mental health, social determinants of health, physical health, prevention of cardiovascular diseases, education, mentoring. So food distribution, food insecurity was a new area to us. We have been advocating for access and equitable access to SNAP and ensuring that the policy was implemented appropriately so children could access SNAP. But the community food distribution hit us new and really hard. In March, families reached out to us saying, we don't have food, I lost my job, there's no transportation, I don't have a car, I cannot go to the supermarket, and I don't have money to go. And that was really immediate in March. So we started with 20 boxes. We partnered with faith-based organizations. They were sites getting food from different sources, donations, the city, and they were getting meals. So we arranged a group of volunteers. We will go there, pick up the food, and then deliver to the homes. Many of the families were already impacted by COVID-19, and they were positive. Soon in April and May, the 20 families became 200 and then 300. And at some point we had 600 families that we were providing cash assistance and food. The reason we were very motivated to do this job was the inequity. People who were hungry could not stay home. They had to leave their houses every day, 2 or 3 times a day, to be able to get a meal either at school or a community center. The resources are really valuable, but it was not sustainable for the family to be able to stay home, especially if they were sick and we were trying to prevent the spread of COVID. So there was a motivation, and we came together, a group of different organizations came together to start delivering food, and primarily in the city. We ended up working in collaboration with these multiple organizations to provide stipends to 11 drivers who are members in the community who lost their jobs, and they will help us distribute. We also had 4 interns to help make phone calls and reach out to families, ensure that our addresses were correct. We recruited 150 volunteers also to help distribute. Delivering food to 26 zip codes is a lot of work. And the zip codes are all over the city. Remember that we are located in the southeast Baltimore, but we had distributions in Pikeville, in the Pikeville area, Falstaff, and South Baltimore, Lakeland. And we needed a lot of manpower. Also trying to prevent the big crowds. We had to have a lot of control of how many people we had in the same room. 249 individuals in different households reported to be COVID positive. So we also work with them to find them housing or temporary housing with the Tree Baltimore. in the Lord Hotel to make sure that they had a place to quarantine. Overall, we were serving 476 families in average since April and May in 2020 until December. And right now we actually increased the number of sites where we are distributing food. Next slide. This is a list of partners that we have had, and I want to highlight the ones that are in the center of the slide. Those are faith-based organizations. And Sha'Von was just giving us an example of how powerful working with churches and pastors and communities is for our community. So for immigrants, these are the first places they go to, and they trust these communities. The success of community testing has been very important because of the partnership with faith-based organizations in Southeast Baltimore, for example. And the power of advocacy that these communities have is super important and should not be ignored for future initiatives. So we were partnering with Pompeii, with Sacred Heart, Gallery Church, and Breath of God in the Southeast area, and they helped us to really reach to those 26 plus zip codes. Neighborhood associations, the Comité Latino de Baltimore had a great connection and network in the city. And then as we were making progress with the food distribution, we started in the West, Baltimore with Montclair community, and partnering with other organizations like So What Else. The support and advocacy from elected officials in the area was also super important to ensure that the voices and the advocacy for these communities were very active. In the map on the right, I marked the areas where we go and we have to drive when we were doing deliveries. And now these are the communities that, you know, people drive to where we are, to the sites. We are in Highlandtown all the way on the right. And we're also on the west arrow. So people are driving to these areas to pick up the food. We are delivering to the counties in the borderlines of the city, but really very few families. Most of the families that we serve are in Baltimore City. I am particularly grateful for the collaboration with the Food Policy Initiative team. They have been very patient and have been really listening to our requests. In terms of like referring people to food delivery access, food deliveries, because many families were not able to make phone calls to 211, and they cannot access to this like citywide services are very limited on language capacity. So that was pretty much it. The next slide is just a summary photos of some of the events that we have had. With food distribution. Last year was also the census, and that helped us connect with promotoras and work with community members to distribute food, which has been the core of a lot of community outreach efforts to provide information, reliable information, demystify some of the information around COVID and now around the vaccine, and also promote the community testing sites. And yeah, thank you so much. I would love to answer any questions.
Okay, thank you, Monica. So we have a question. I think, Holly, this one you might answer. It's just really a question of data. Are we collecting data on this Alice?
Sure.
Baltimoreans. Okay.
So what's important to know, what Alice means is that it includes the data of people who do qualify for a federal nutrition assistance program, but also those who are still low income, but not below the poverty line, but still really significantly impacted. The issue with the Alice data during COVID is it's out of date. It's aggregated data in the same way as all the other data. And that's why we had to resort to SNAP data on a monthly basis issued by the state during COVID to understand the real need. And yes, we do have access to the Alice data through the Maryland Food Bank, and we partner very closely with them. And the other question I can answer really quickly on urban ag, every jurisdiction is different. We did not need to have a piece of legislation like that, but we did have to change the zoning code to allow for it. And we also needed, we have a tax incentive for growers in the city of Baltimore.
Great, thanks. So, it seems to me that food access is very complicated. There's the issue of accessibility to stores. When you say there's a food desert, that there aren't places where people can access fresh food because there's not a supermarket in the area, the transportation might not be good, or they have to drive so far. That's one issue. The opportunities that you talked about and Sha'Von's talked about of you know, the communities being able to do these either church gardens or, you know, larger things, the urban agriculture, some of these larger urban farms that that we hear written about. So for our group, I mean, what are hurdles in the built environment that architects and planners can address that would make food access sort of a simpler thing, or you know, help to bring solutions to the communities? And I'll take comments from all three of you.
I guess I can go first. So there's another book that I want to reference called Black Food Geographies, written by Dr. Ashante Reese. And in this book, she talks about how food access is synonymous to racial segregation. And honestly, I try to stay away from the term food access because by definition, food access is just having close proximity to a food retail outlet and having the ability to acquire the food from the food retail outlet. But like you mentioned, that doesn't account for transportation, that doesn't count for the cost of the food, that doesn't count for if the food is culturally appropriate and able to be utilized, and that doesn't necessarily account for if the food is nutritious or not, and like what is the expiration date on the foods. So, but back to my original point, with food access being synonymous to segregation, because a lot of the neighborhoods that experience food insecurity or healthy food priority areas, I would say they were created by design to be those areas. And earlier this week, actually, we talked about how the redlining map that was drawn in the 1940s, if you overlay that redlining map to the healthy food priority areas map that was created in 2018, you will see so much overlap, because although that redlining map was drawn by the Homeowners Loan Corporation, and it was drawn to decide interest rates and loans that should be used to purchase housing, but also that map can also speak to resource allocation during that time. So resource allocation followed the healthy food priority area map and followed the grocery store map. So I think to answer your question is like, what can designers and planners and architects do to be more conscious of the segregation of resources, is to design from a community-led approach. Because I think a lot of the approaches to address food security, food insecurity, food access has been centered from a market-based approach, reaching out to corner stores, reaching out to grocery stores, reaching out to food retail outlets to anchor themselves into a community, not necessarily accounting for the economics that go into why those outlets are not in the community in the first place. So I think what designers can do is just have more of a participatory process and use more of an equity design lens to ensure that the community assets and resources are considered in the design of these communities to address these long-term systemic issues such as food insecurity.
Thanks. Let's see. We have okay. So Monica, you had said that food access was not one of the areas that your organization had focused on until COVID hit. Is this something that you think will pass, or is this something that you think as a result of COVID has become is an issue that existed that maybe you're now much more aware of?
Mhm. So there are different factors, and just chiming in or adding to what Sha'Von said, how the policies are implemented is to perpetuate where families stand, especially marginalized communities and communities of color have been heavily impacted by how policies are being developed. So SNAP has been one of the main sources for healthy food for immigrant families and communities of color in general, because that feeds the family. And in a few years ago, the federal administration approved the public charge rule, which basically says if you are an immigrant and have ever received any type of social benefit, and by any type, they listed the benefits that qualify you to get an immigration status. They included Medicaid and SNAP. So what families started to do as soon as the public charge came to the public was to unenroll their children from SNAP. So yes, the problem existed before. There was a solution to that issue, which is through SNAP, but now families are scared of how they are going to use that service. Is it going to hinder their ability to be able to get an immigration status? Our work is really to promote equity for these communities, equity in health and opportunities and resources and services. We're going to continue working in the areas where we see there is a need to advocate for this equity for the communities. And right now, food access has been one, but like housing is a long-standing issue in the community that it doesn't come, like we cannot include that. We don't have the capacity to address that right now, but it's definitely something that is in the back of our heads and that we're trying to speak up and represent the voices of the community. So in short, I am not going to say that we will continue doing that. We will continue doing the work that is needed to ensure that people have equitable access to resources and services, and they are not hungry. A family should not be debating between paying rent or getting food.
Right. So I'm still trying to wrap my head around what a solution, and you know, I think it's a lot of things. And Sha'Von talked about leveraging, you know, community-based assets to find solutions. So I don't know if any of you have an idea of, you know, can paint a picture for this audience. What does a healthy food network look like?
I can say something very quick. I would love to hear Sha'Von and Holly's thoughts. But something that I keep daydreaming is being able to walk to where you can get food. Do you know, like the families where we have been delivering food don't have a car to get food. So they don't go to get food. And that should not be a barrier for people. So how are we designing our cities is very important. It is a public health issue. The city should be designed so that people can access the services in an easy way, so that a mom with 4 kids cannot tell me, can you bring me food because I'm hungry, my kids are hungry, but I don't have a car. You know, like they cannot even imagine like taking the bus and have a 45 1-hour-minute commute to be able to get a box of a produce that is going to last for 5 days, and then they have to repeat that process again. So I think that design, from an architectural standpoint, I think a design that is accessible for people, for humans, and more for humans and less for cars will be ideal. Baltimore is I love Baltimore. It's a beautiful city, but I think we're making the design more and more complicated for people. And those who don't have resources are the ones who suffer the most.
Sha'Von, do you have comment, or Holly? Okay.
I'll speak into the issue. So I think it's very important to understand that we cannot feed our way out of this issue. It's actually not about food, right? It's about poverty. It's about structural racism. It's about education and resources. And so we need to always keep going back to the core root causes. And Sha'Von shared and discussed so well, really looking at the past of structural racism and really all the impact it has still today. So when we're looking at how do you create what you're calling sort of a healthy food network or environment, I think it's very, very important to understand it has to be resilient, meaning multi-pronged. It needs to have, a diversity of retail and resources, from small food retail to co-ops, to a supermarket, to a public market, to urban farms, community gardens. But it can't all be focused on one access point, and it also must have really strong transportation networks. What we know on average is from Morgan, Professor Celeste Chavis's research that just came out this past summer is, on average, people shop at 2 to 3 grocery stores, and they do not shop at the closest grocery store. Yet people do want to walk to get food. And we need to make sure it's a safe environment for people to walk. And we need to make sure that there's multiple types of healthy food options that are culturally appropriate in the communities.
So, that seems, I guess some would argue that, there's an economic challenge that needs to be overcome, because if you decide you're going to be a food retailer, you need to be sure you can sell enough product to survive as a business. How is that issue addressed in the city?
I will speak into one of these issues. I think I want to lift up Black Yield Institute, who's not here, and Eric Jackson on the work of really looking at food co-ops, Black and brown led food co-ops. I think that the focus really during the Obama years, when food deserts became sort of this phenomena and the answer was all about supermarkets, that is really not true. And it's supermarkets, cities do not get to control where supermarkets go. And when they come and when they go, it's all economics. But when you're looking at wealth building within the community and small retail and multiple kinds of retail, and so having developers and architects really supporting the community-led efforts that Sha'Von was speaking to, and others.
Let's see, looking at some of the questions in the chat box. There's a question here. I'm not sure I understand this question. It looks like this person is originally from Australia. It says it doesn't appear to be an overarching plan of support. Seems like a lot of good people working very hard, but I wonder if a greater.
I can speak to that.
All right, you got this.
Yeah, I have this one. So first of all, I would like to disagree with part of that comment. What Baltimore and 20 other cities around the country and many more is understanding the role of government in food, and that that there is a role. It cannot be alone by any means, but government has to play a role here. And so one of the roles that we're doing, but by no means alone, and many other leaders as well, is really looking at that coordination of the linkage of government and to nonprofits. And what we're seeing here, it's called our Food Policy Action Coalition, and many other networks that exist as well. But I think that this is a movement across the nation, around food policy councils. And some of them are embedded in government, some are not. And so there is much more of a stronger coordinated effort. But if you're referring to a national food policy or strategy, no, we do not have that. And then I saw on calls earlier today on sort of that advocacy to do that. But we are seeing a lot more coordination and collaboration in local jurisdictions on this issue.
Thanks. Well, when I started sort of promoting more sustainable building, and actually when I started this consulting company and sort of left a traditional architecture practice, I talked to a lot of the architects around town and asked them if they were doing, green buildings or LEED certified buildings. And this was sort of early, 2004, 2005. And, a lot of architects said, well, nobody's asking, so we're not doing it. And I talked to some developers and they said, well, the architects aren't talking about it. And, we see them as our experts. So they're not talking about it. We're not asking about it. We're not doing it. So it was clearly a chicken or egg kind of thing. And I think architectural practice has gotten fairly complicated because, we're talking about material safety and health and health of materials, and we're talking about environment, and we're talking about energy, and now, this issue could be another issue. And I think, and I said at one point that when you're doing a project, you have a responsibility to raise issues that the developer or the client might not raise, because it's like informed consent. If you go to the doctor and the doctor sees something and he says, well, because you didn't ask me, I didn't tell you you had this, issue, you would consider that malpractice. And so, my argument is to the design community is you have an obligation to raise these issues as a matter of professional informed consent. And if the owner says, well, I don't want to do that, well, then that's fine. You can't make them do that, and you don't have to get on a soapbox. But so maybe one of the things that's important to do if you're working in certain communities or certain types of neighborhoods, and to bring up some issues about whether or not the project should consider including this or being that, or engaging more with the community if they're not doing that. But a lot of this is not in the architect's hands. But I think, I think what we're learning through a lot of this is the conversation is so important. Just starting the conversation, and I would, I just make that as my own contribution to this to this discussion. Let's see, we have a couple of other things, and we're probably getting out of time. Well, there are a lot of comments, not so much questions. Somebody's asking about food mobility and the future of they're calling it food on wheels. And if that's something that could work in communities.
So I guess that refers to the pre-cooked meals, right?
I don't think necessarily. No. I think it could be groceries. And I think, it's kind of what you're doing, isn't it? I mean, you're putting these food boxes and transporting them all over the place. But what if it was a market?
It's not quite that, so we have quite a few. And I was thinking, Sha'Von, you were going to speak, so I was waiting, but I'll go first here. So we do have, Real Food Farms has a truck that is a produce truck where they grow the produce and move it around the city. Also, we have one in Vazquez. So we have two different locally grown produce trucks, which are really innovative. So we have two in our city, not one, which is great. And then also we have to understand programs versus policy and structure. Programs are great, but they're only the symptom to the core issue. So yes, we do want to see the produce trucks, and we have farmers markets and nutrition incentives at farmers markets. But that is really sort of the end of the issue, not the beginning. But Sha'Von, maybe you can speak a little bit more to the CSA and the markets that you're doing again.
Yeah, I kind of want to pick up on Peter's point before about starting the conversation, because I think so much of this solution-oriented work or this program-oriented work to address food insecurity is kind of rooted in the approach of let's go and save the food insecure people. Let's go and save the poor people by doing these things. And it's not necessarily rooted in building up the capacity of these communities to make it through these challenging times or these times of crisis. So what I want to add to that is just taking a step back and just deciding what is the value that you're bringing to these communities. Because I was on a panel a while ago and someone asked the question, like, we have been doing these food distribution boxes, but we realize that so much of the food is being wasted. What should we do? And I'm like, the question isn't necessarily what you should do with the food that's being wasted. The question is, why is the food being wasted if you're serving people who are considered food insecure? And the why is rooted in, are the foods that I'm making available to the community culturally appropriate? Are we having these conversations about dietary preferences? So back to the initial point of a Meals on Wheels program, of a food delivery program, I think the root of it is to first acknowledge, like, what are exactly the food needs of the community, and what does that look like? What are the dietary preferences of the community? What also are the cultural sensibilities of these communities? Because that's where a lot of these programmatic efforts fall short, because one, they're not building up the capacity of the community to learn how to address their own problems. And for two, it's doing it through a charity approach of let's just feed and let's just give because that's good in the moment.
Good point. Thank you.
And that's also, yeah, that's reflected on the, during the pandemic last year, how much food was, how many sites were not able to distribute the meals, and they were not understanding, you know, that many people were wondering, like, why do we have food left? You know, like, people don't need food. And for the immigrant community, like, that food was strange. It was not something that you can easily cook or eat, or, you know, and we were distributing boxes of food. I'm just exemplifying what Sha'Von is saying, right? Like, we knew people needed food, and they would receive calls, like, either I pay the rent, or I get diapers for my kid, or I get the medications, or I get food. Like, it was a lot of debating of what they needed on a daily basis. And then we will come with a box of canned food, and they will say, well, I still need food. And we were thinking, why? We just gave you a box of like 30 pounds of food. Why do you still need food? Well, because I don't like the canned food. I don't know how to make half of the stuff that you gave me. And it's not what I eat. It's just not what I eat. So then we had to, like, have conversations with the sponsors and partners to make sure that we were providing what the community needed. And we were able to get some funding to get beans and to get flour, corn flour, and that is no hesitation. They want that. So yeah, listening and basing the food on the community is super important.
Wow. It's enlightening to hear from all of you, and sort of the complexity of the issue. I think to the extent that, you know, what we've heard is, I'll just say there's a lot of great discussion, really, as much as there are questions in the chat box. And Nathan or Kathleen, I don't know if you can preserve that and somehow distribute that chat.
I can do that, Peter.
Yeah, because a lot of good comment in there. But I think we're at the end of our time, actually a little bit over. But I'd like to thank everyone. If people have any final comments or questions, put them in the chat box and we'll see if we can pass them along, or share the comment or pass the question along. With that, I'm going to thank the panelists, thank AIA and the audience for attending, and close the program. Thank you very much.
Thank you all very much.